Hello everyone, I'm Kavita Prasad and the Medical Director of Integrative Medicine at Zumbro Valley Health Centre, a research collaborator with Mayo Clinic and on the Rochester Epidemiology Project Executive and Research Committees. I'm delighted to share with you today an article which will be published in Mayo Clinic Proceedings, Innovations, Quality and Outcomes, titled Use of Complementary and Integrative Medicine among low-income patients with mental health disorders. This work was done in collaboration with Harvard, Mayo Clinic, as well as the University Hospitals Connor Whole Health and the Center for Reiki Research. We conducted a survey on outpatients attending Zumbro Valley Health Center. This is a behavioral health clinic in southeastern Minnesota, which serves the underserved population in the United States. All of our patients have a diagnosis of a mental health condition and/or a substance use disorder, and represents a population in whom the use of complementary and integrative medicine has not been previously evaluated. So we conducted a 23-item survey on our patients, and this was developed in collaboration with the Survey Research Center at Mayo Clinic and included evaluation of our patient demographics, their current health conditions, substance use, alcohol use, nicotine use, and use of complementary and integrative medicine therapies, its perceived benefit, and patients' interest in future use of these therapies, along with their social determinants of health. Among the patients that were surveyed, depression and anxiety levels were high at 87 and 84%. Social isolation and loneliness was also common. The three most common modalities that our patients were using were prayer, spirituality, and music, with complementary medicine use having benefits for improving mood, stress, reducing pain, and loneliness. 1/3 of our patients were adding complementary therapies along with their conventional treatments, and approximately 20% of our patients reported that traditional medical treatments did not work well for their symptoms. More than 2/3 of patients had not disclosed their use of complementary therapies to their physicians. Additionally, social determinants of health was not associated with use of complementary therapies. With the global increase in mental health, we believe this is an opportunity to innovate in mental health care. Ultimately, the model of healthcare needs to be revised to improve patient well-being and reduce healthcare costs. We believe this is an opportune time to highlight the efficacy of providing a holistic approach to health, incorporating a biopsychosocial spiritual model of care. The major implications for clinical practice from our research study is that there is an unrecognized use, interest, and benefit with the use of complementary and integrative medicine among low-income patients with mental health conditions, and these therapies may be proved to be useful adjunctive therapies and benefit further research. At Zumbro Valley Health Centre, we have been providing complementary therapies for our patients with mental health diagnoses for the last 3 to 4 years. Some of these, including biofield therapies, have been provided at no cost to our patients with benefit in mental health. Based on this research study, we are expanding the services we're providing, incorporating spirituality in mental health care with the Mantram Repetition Program. We sincerely hope you enjoy reading the article.